quickly revise Eustachian tube. It is mucus-lined channel, connects nasopharynx with middle ear, maintains equilibrium of air pressure on both sides of tympanic membrane. 36 mm length. It has two parts, bony part is 1/3 and cartilaginous 2/3. Isthmus is narrowest part. Cartilaginous part is made up of elastic fibrocartilage, which forms most of the wall except lateral wall, which is fibrous. Direction is downwards, forwards, medial from middle ear towards nasopharynx. It's horizontal in infants, oblique in adults. There are two ends. Tympanic end is small, opens in anterior wall of middle ear. Pharyngeal end is large, opens in lateral wall of nasopharynx. Lining is pseudostratified, ciliated, columnar epithelium. When Eustachian tube is blocked, leads to retraction of tympanic membrane. Recurrent middle ear infections in children is due to short, wide, horizontal tube.